Hello, Colin Hung here for Healthcare IT Today, and I am at the OntarioMD Digital Health Conference 2025, right here in my hometown, Toronto, Ontario. I always love coming to this conference because it's a really great read on everything that's happening digital health-wise in the province. Now, I'm about to sit down with someone I have not interviewed before, and I'm excited to have her on the program. Dr. Chandrasena is the Chief Medical Officer at OntarioMD, and she said something on stage that I really wanted to ask her about. She was talking about not being too prescriptive when it came to building a playbook for digital health in Ontario, yet at the same time doesn't want it to be the wild, wild west, kind of like what we had in the early days of EHR and EMR certification. So, what is the magic Goldilocks zone where we get it just right? Well, let's find out, and let's get to it.
Hi, I'm Dr. Chandi Chandrasena. I'm a family doctor over 20 years in Ottawa. I'm the Chief Medical Officer at OntarioMD, and thank you for inviting me to this conversation.
I'm honored to have you. It's been too long. I mean, I always get Chris and Robert. Now it's a chance to talk with you, so I'm excited for this. I wanted to talk to you about something you mentioned while you were up on stage. You mentioned this idea or this concept of, I'll call it a light playbook. Where you were going to create some standards, but maybe have some vetting of some of the vendors and technologies that are available to primary care physicians, but not be prescriptive in how they can deploy it. Can you talk to me more about that philosophy?
Yeah, so I think it kind of comes down to digital health. So I think everyone thinks, okay, you've got your clinic, you've got your clinical processes, and then digital health, right? And I think we have to start integrating them together. And then everyone's like, well, I just want a recipe, right? Like, tell me what steps to follow so that my clinic can be digitally optimized. And so I can't give you a recipe because technology is an enabler to the problems you have. So what I think we have to do is we need to have standardized workflows for sure, and some sort of roadmap, and kind of, I don't like to call it a recipe, but I call it a structured toolkit.
Okay.
And I think it needs to be able to be flexible to who you are. So if you're a brand new clinic about to open up, then yeah, you could have the more mature structured toolkit. But if you're an existing clinic or bringing two clinics together, it's going to be very difficult to follow. So I kind of feel like that one has to be kind of tailored to you. But we don't want everyone to do their own stuff because that's what we're doing now and it's not working. So you need it to actually also be a bit standardized. So everyone's kind of like choosing an adventure, but the adventures are limited by the book. So you can kind of allow for that innovation, but at the same time, you know you've got key things in place that allows us to work together.
I mean, you're going after the mythical Goldilocks zone, right? Where it's just like not too much, not too little. But to your point, like I'd hope we've learned our lessons a little bit from the EHR, EMR days, right?
Yeah.
Where we had, hundreds of certified EMRs on the market, and we left it up to the market to decide.
Yes.
But then over the years, what's happened is, of course, everyone's consolidated. We've had some stumbles. We've had some companies that really shouldn't have been in EMR in the first place. It sounds like you're trying to avoid that chaos, but not be so prescriptive where we only have one solution to choose from.
Right. So I'm not a big proponent of one solution fits all, right? It doesn't work for medicine, it doesn't work for clinics, it's not gonna work for digital technology. But you're absolutely right. Hindsight's 2020. So if I look back, how should we have onboarded EMRs? We probably should have done it a little differently, especially around data quality and data fields and looking towards that sharing piece. But when we started EMRs, we weren't thinking of sharing. So that's kind of like, okay, lessons learned. So now that we've had the EMRs, even though they were certified in Ontario, so you had to pick certain ones, I think now with digital health, we need to be a bit more agile, less prescriptive, but still make sure that we have the basics there. But we also need to kind of say, okay, this is where we're going. We need that vision or roadmap, and we're just learning that right now.
Can you give me an example of some of these digital health tools that maybe you're looking at that would go into, not the recipe, but into this toolkit?
Yeah. So for my thing is, I don't think technology is not a magic wand, right? Like you're not going to use, let's say AI Scribe. you're not going to pay for AI Scribe and all of a sudden gain all this time. So my thing is, look at what your problem is first, right? And look at what you have already in front of you. So I'm probably not going to be popular, but for me, it's like, look at your team, look at your clinic, look at where your gaps are. Maybe technology is not the answer, right? So maybe you shouldn't go out and buy the shiny new technology, because you actually have to work on the culture of your clinic or the workflows or the policies. But maybe technology is the answer, in which case you have to make sure that that technology is meeting your problem. So my thing is always figure out your clinic, figure out what you want to deliver on, then figure out your workflow, and then find which technology fits to make that easier for you. So for AI Scribe, there's some great data. It helps a lot. We're saving so much time in administrative work, right? But what we're finding is it's not for everyone. And everyone thinks it's so easy. I'm just going to open up the box and I'm going to start using it. But there's a learning curve to it, and you have to be ready to do that, to use it to its full functionality. So what OntarioMD did is, because there's so many out there, with the government, we looked at the clinical requirements needed for AI Scribe, but also the privacy, security, like the regulators, get everyone on the same kind of page. And then you have a vetted list. And so then if I'm going to pick it, I know that it's one that's been vetted, right? And so I think there's value for that, because as a doc, I don't have time to go to 20 vendors and figure out which one. I love that there's something I can pick that I know has been looked at.
By people who have vetted it for for the clinical needs that we have.
Exactly. And the clinical needs for it was developed actually community up, right? So basically it wasn't just an organization saying you need A, B, and C. It was a lot of advisory groups, a lot of input, a lot of clinicians, docs, nurse practitioners, even staff, to kind of say these are what we needed to do, and that's how it was developed.
Now, as the CMO of OntarioMD, you come across lots of technologies. You get a chance to see a lot of technologies. Yeah. Other than the AI scribing stuff, is there any technology that's got you excited?
So, there's a lot of stuff. So we're working right now on AI clinical decision tools, which would help kind of with the guideline piece of things. So as you're seeing patients, but AI in box is actually really what's exciting, is that AI assistant to get those messages out. Like, could we have a technology that looks at all these reports and kind of triages it for us, right? Or deals with the stuff that doesn't need to be dealt and delegates stuff out. So that's really exciting, right? So I'm kind of looking forward as that develops. But AI Scribe's kind of, I don't want to say it's easy, but it's easy. Like, in terms of governance, regulations, privacy. So as we go into clinical decision tools and AI inbox, where now there's more uncertainty, we have to really think about what that means for the people using it and the patients, right? Like, they need to know.
And then AI scribing is, let's be honest, it's the sexy thing of the moment. And it is great, because it is generating real return for people. Yeah. Giving, we've heard stories where it's giving joy back to the practice. Yeah. So all good things.
All good things.
But it shouldn't stop there. It's, what I'm hearing you say. And clinical decision support is another place where AI could be really helpful, at least to deal with, as you put it, some of the less acute challenges, and maybe get some things off of people's plates.
Exactly.
Interesting. Okay. Anything else that you're working on?
Yeah. So education is kind of, I have to tell you, is my passion, right? It's that digital literacy, because I think we have to be careful we don't create inequities. And we're already doing that with technology, right? So the clinics that are really good bandwidth, let's just talk about internet, right? So if you're in an area of the province where you have really good internet, you could use a lot of this. But if you don't, you can't. So now your patients don't have access to it, you don't have access. So there's this inequity there. If your population of patients just don't have access to a computer, right? Like, it's a reality. So then if you've got a patient portal and you've got like online booking and you're using AI Scribe and you're sending them like documents, how are they using it, right? And so then you're creating this divide of haves and have-nots. And I think, so what we look at is education, but I like to call it knowledge translation, because when people think of education, they think it's a webinar or a textbook. I think it's more understanding what technology is out there, then figuring out where the gaps are, and then figuring out who can help with those gaps. So maybe it's a conference like the one that you're at right now. Maybe it's a webinar, but it could also be a one-on-one for someone to understand where you are and then find those solutions and workarounds for you, which to me is knowledge translation still, right? People call it change management also, but I think that's what I find needs to happen, regardless of what you use.
Well, maybe you can get together with the Honorable Jane Philpott and talk. Philpott, sorry, and talk about maybe incorporating more digital into the curriculums of the primary care docs that they're trying to mint.
Absolutely, absolutely, and I think it needs to start. So I would actually venture it needs to start in kindergarten.
Okay, you're going even further.
I'm going even further. So definitely in the med schools, the nursing schools, like any clinician, anyone who touches a clinic or healthcare should definitely have it. But I actually think it needs to start. Like we're a public system, right? So as a public system, I think we need to start teaching from a very young age what that means to be in a public system, how you use the resources, how you navigate it. Like you don't need to come to me for everything as a doc, right? So you can go to other places, but we need to start teaching that just like we teach everything else. And then we need to teach literacy and as you go along so that when you graduate and whatever it is that you do, you've got this basic knowledge of how it works. And AI, as shiny as it is, there's a lot of like not so shiny stuff there that really needs to be unpacked, right? And people just need to be aware of it.
Right, so much like they're now starting to teach media literacy to help people discern
what fake news
is, what's real. You're talking about health literacy to distinguish, well, A, just to be a healthier person, but B, I like where you went in terms of helping people know what level of care maybe to access.
Exactly.
And that's not something that is taught anywhere, right?
It's not.
Do I go to the urgent care? Do I go to the ER? Do I see my family, my family physician? Which is the right level to go to? Absolutely.
And now with AI, that's direct to consumer marketing, right? So you've seen all the apps and the companies that innovate for patient triage and chatbots, empathetic chatbots, and you don't need to go see anyone because I'm going to come to you, right? But you haven't actually given any of them the tools to know, how do I know this is like a legitimate one? How do I know that I'm safe doing this? What does it mean that my data, like, there's a lot there that's not explained, and not all, I mean, there's a lot of companies that take advantage of that, right? Like data is a hot commodity, right? Yep. Forget Bitcoin, it's your data that they want, right?
Data's worth a lot.
Data's worth a lot, and we're actually giving it away, and we're actually paying a company to take our data, but without realizing it, and I think there just needs to be a lot of knowledge translation around that, right? Like, what does that mean to you?
I love it. Yeah. I love it. Well, so hopefully OntarioMD will come out with some of these educational initiatives then. That'll be a lot of fun to see.
That's our plan.
I like it.
Yes.
I like it.
Yes.
So we're here at the OntarioMD Digital Health Conference, of course.
Yeah.
What are you hoping that by the end of this, the attendees will take away from being here?
I know. You know, that's a really interesting question because the attendees are varied, right? So at the end of the day, this is geared to a practical use of your digital health technology, right? So whether you're a nurse practitioner, whether you're a family doctor, a specialist in the community, or staff in a clinic, or an ED, or an office manager, if you can take 3 pearls that you've learned here, that you can go and make your life so much easier in your clinic, to me, that's a win.
That's a win.
That's a win, right? Because that's what we need. We need to make those changes because once you realize, oh, that was easy to do, now you spark this interest and now it's like the next step. Oh, maybe I'll do this, maybe I'll do this. But right now, you know, our interest isn't always sparked because we're so tired, right? So I'm like, 3 pearls. So anyone who's watching this, if you didn't get 3 pearls, come talk to me because we failed.
Yeah, and you'll help them find the 3 pearls.
I will.
I like it.
I will. I will. Absolutely. Yeah.
Well, this has been fantastic to sit down with you, Chandi. Where can people go to connect with you if they want to connect with you? On
so
LinkedIn?
I'm on LinkedIn. OntarioMD, if you go to our webpage, I'm listed as leadership, so I'm there. Honestly, people know how to find me, I have to tell you. But yeah, I'm pretty findable, actually. I think if you Google me, you'll find me pretty easily.
Perfect.
Yes.
Perfect. Well, excellent. Well, thank you so much for being on the program.
Thank you for having me, and I really appreciate this.
Hey, I really want to thank Dr. Chandrasena for joining me on camera and giving me her views on that digital health playbook that we need in Ontario, but also talking about the need for increased digital health literacy as well as general health literacy. and how we maybe need to have that ingrained in the K-12 education system. I can't wait to see where her passion for that takes her, and I can't wait to see what else comes through her work here at OntarioMD. And hey, if you enjoyed this interview, please mash that like button and click subscribe so you can get more great interviews like this one. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.